Association between medication adherence and blood pressure control in urban hypertensive patients in central India. p. 9. Ratinder Jhaj, Pushp Gour, Sweta Kumari, Shweta Sharma. DOI 10.4103/JNCD.JNCD_29_16. Introduction. Cardiovascular and renal complications associated with hypertension, HTN, can be reduced if blood pressure, BP, is well controlled. However, a large percentage of patients fail to achieve target beats per second, largely due to poor medication adherence. We conducted a cross-sectional study of patients of HTN to assess patient adherence to treatment and the association between medication adherence and BP control. Methodology. The study was a cross-sectional survey of adult hypertensive patients of either sex who had been on antihypertensive therapy for the past 3 months. Medication adherence was measured using the 8-item Morisky Medication Adherence Scale, MS-8. Level of control of BP was evaluated using the BP goals recommended by the 8th Joint National Committee, JNC8. Results. Out of a total of 200 patients, only 29.5% of patients had achieved their target BP as per JNC8 recommendations after a minimum of 3 months of antihypertensive therapy. The average adherence score on the MS-8 was 6.47, plus/minus 1.8. A high adherence was found in 39% of patients, while 32.5% of HTN patients had a medium score and 28.5% had low adherence scores. There was a significant correlation between medication adherence and BP control. Only 1.5% of patients with low adherence score and 11.5% with medium score had achieved their target BP, while 16.5% with high had done so. Conclusion. Higher medication adherence scores were associated with better BP control. However, the percentage of patients with controlled HTN on treatment was low, as was the proportion of patients with a high medication adherence score.